Hey, good afternoon, everybody. This is Brittany Jennings with the Seniors Blue Book, and today I am with the nurse practitioner, Teresa Passalaqua with BlueStone Physician Services. How are you?
I'm doing well, thank you.
Good. Thanks for joining me today. Super excited to be on the topic of basically some tips for health. But first, I want to ask you a little bit about yourself. I love getting to know people a little bit deeper than, our titles and what we do. So tell us a little bit about your background.
Sure. I've been a nurse practitioner, I think, around 8 years. I've been with Bluestone for 4 of those years. And it's been, I love it. It's, the company is mobile health clinic that goes into, we do nothing but assisted living and memory care. We care for residents, our most vulnerable of our population. And I feel like it's the most rewarding job I've ever had. It's just wonderful. And I've had a long nursing career. We do monthly visits for chronic care management, and by doing that, we keep on top of their health, keep them out of the hospital. Our whole goal is to give them the highest quality of life we can at this time in their life. So I feel like we just focus so highly on maintenance and making sure that they are, they are healthy and stay at the top of their level, that we provide them such a service to make sure that that's taken care of.
Yeah.
And I just got nervous.
Oh, don't worry. I know you're doing fantastic. I know from working in assisted living and seeing the difference, it can make such a huge difference and impact on their life, their quality of care, when they do have a physician who comes into the community and sees them. Number one, you don't have to go out and be in a doctor's waiting room. I mean, a lot of people think of that first, but I know on the backside, when a community, let's say something has happened, maybe somebody has an infection or something, that always happens at either 5 o'clock or on a Friday or a weekend. And so I know how hard it can be sometimes, or challenging it can be, to get a hold of primary care doctors on the weekend or in emergencies. So you guys are easily accessible. There's also a port, right, where people can go into, family members as well as the community, right?
Yes, that's our bridge. The residents and the families, the nurses and the families, the facilities can get a hold of us with anything. They love it because it's an instantaneous reply. They get the orders they need right away. The families are kept abreast of what's going on with their loved ones. So it's just a win-win. It's a wonderful communication tool. It's like a HIPAA compliant Facebook, if you will, for each resident. So,
yeah.
But I will tell you, my residents love the fact that I'm coming in their home. I'm able to see them. They're eating breakfast. We sit and chat till they get done with breakfast. They love that time that I spend with them, not just for their health care, but just the time, especially right now in these times. I feel like they really love seeing our faces and seeing us come in and sit down and talk to them, so they can share all their, because that's what's important right now. They're not able to see their loved ones.
And you get to, in one sense too, a lot of the families live out of state. Sarasota and the surrounding counties are retirement capitals. People move here for the beaches, the golf, all that good stuff. And a lot of times their families are out of town. So you get to come into the building and be that family member for them, which is super special.
Absolutely. Absolutely.
So let's get into our topic today. I'm super excited to, it's always the goal of Seniors Blue Book, but me personally, I always want to deliver some great resources. So of course, Bluestone in general, you guys are in the communities. But let's talk a little bit about, there are people watching that are at home, that are, whether it's professionals or caregivers or seniors themselves, that are maybe looking for some tips for their health. And today, I think we're going to talk more about preventative health and making sure that people understand the importance of their routine visits with their physicians. Could you just tell us a little bit about that?
So the routine visits are extremely important anytime, but I feel like they're more important now. We want to try and keep people out of the hospital where it lowers their risk of contracting the COVID. So we are seeing them monthly. We're making sure that all their medications are correct, that their blood pressure has been stabilized, and all those, because with our geriatric population, their condition can change quickly, and we need to be on top of that so they don't have to go to the hospital. I know I have one resident right now that I've been really working with to control her blood pressure better, and kind of changing things and trying to stay on top of that. So I'm seeing her more often, And because that's the last thing I want to do is have her get sent to the hospital, for this blood pressure. So it's those kind of things that we're maintaining, staying on top of change in cognition, being able to control that. You'll see a lot of the change in cognition due to the quarantine. They're not able to sit in the activities and do things. They're not as stimulated as they were. And everybody kind of feels a different sense. There's a different aura in the facilities when you go in, and you can't help that because there is a little bit of anxiety from this. So we try to take care of that so those behaviors don't get out of control. We can help work with nursing to make sure we can help them with that. So it's a time right now that we need to be really aware of what they're feeling and what they're going through, and that we're really on top of medication needs, things like that, because we don't know from one week to the next what's coming down the pipe, So, and I think everybody needs to be reassured that we're watching over them. I know a lot of my residents have asked me, so I've had them call me and the nurses say, well, Mrs. So-and-so wants to see you. And I go in there, I've had a cough. Do you think I have the coronavirus? And it's like, no, I don't think so. But they hear the stuff on TV and they get nervous, and they just want that reassurance that, no, you're good. You're okay. I'll keep on top of things and I'll be watching over you, and they need that reassurance right now. So.
What would you say on a normal basis, how often would you see one of your patients? Like before COVID?
Typically we'd see them once a month. And that is it takes that to stay on top of what their needs are for their chronic conditions, diabetes, hypertension, COPD. I can name 1,000.
Are you seeing them more frequently now with everything happening, or how have things kind of shifted with how many visits you're doing?
So I think I'm still seeing them about the same. There are a few instances where I've had to try and manage them without sending them out to the hospital. So of course I'm seeing them a little more often. There's times I'll just go in. I don't do an actual visit. A lot of times I'll just go in and say, I'm just checking on you, especially if it's somebody, that's nervous and they want me to listen to their lungs for a minute, something like that. Or my patient with blood pressure, I actually just kind of pop in and do a blood pressure check with her it helps her feel comfortable. Her son feels better because I communicate with him. And, because sometimes nursing has a hard time getting in there and doing that blood pressure. So I feel like I'm probably seeing a few more than typical, on some patients, but for the most part, I'm still doing monthlies. I'm in my buildings weekly. So when something comes up, I am able to stay on top of it, and the nursing can come to me and they know I'm coming. So it's like, Terry will be here. So we'll talk to her about that when she comes in. So.
Exactly. I would think more than ever right now that your services are so needed, because again, I think about being in a community in my former life, and I think about, how the importance of the residents, making sure that they have their questions answered. And because I'm sure that, like you said, there's a cough, there's a sore throat, there's these symptoms that are happening, and they want to know the information. So having your group, mobile physician group in the building it's priceless. Trying to think of the right word to fit in there for peace of mind, not only for treatment, but I know a lot of times coming from a nurse practitioner or a physician, that your word against maybe my word is going to help a resident have that peace of mind and less anxiety.
Yes. And even for the families knowing that I visualize them and this is what they look like. And they had, brightness in their eyes today, and they look like they're dealing with things really well. They're eating well, because you can't see the same, even though they're seeing them via video, you can't see them, they like to know I'm there. I have quite a few families that contact me and say what they look like,
Oh, they miss them. Yeah, I know. In one sense, the technology, like I know you guys also have your telehealth side, but I know that the technology is going to be great moving forward once we're past this, but there's nothing like a human touch, a human hug, being able to just go in and just hold your loved one. So I know just like everybody, you guys are, we're all hoping this is going to be over soon, and that people can get back to seeing their families in the communities.
Yes, I did see one resident last week, and he was telling me my daughter needs to see me, you know, and he said that I go to the window every week. She comes to the window and they
Oh.
wave and they talk, and she drops them a care package off. And that means so much to him. I mean, it was just, he's more worried about her not seeing him than, you know, him not seeing her. But it's those kind of things you encounter every day. And I feel like that's probably 50% of what's so important right now with our monthly visits, is that we do kind of keep them where they feel comfortable and that they know that somebody's watching over them. You know, they have somebody watching over them, and we're not going to let them get sick if we can help it.
Definitely. Well, that's great advice. I appreciate your time, being able to spend some time with us and just kind of you know, people need to practice what they preach and stay ahead of it, be preventive, do what you can, see your physician, whether it is if your loved one's in a community and you're watching, you know, obviously BlueStone is one of the groups. You guys are all over the place. I know here in our market, but also you're in Tampa and sounds like all over Florida, right?
Lakeland, Orlando, Jacksonville, Brooksville, North Tampa, all the way down to Port Charlotte. So yes. Awesome. Our big recommendation is, you know, like you hear everywhere, is wash your hands, don't touch your face. That really is the most preventative. And you know, wear a mask when you're out in public. You know, there's a percentage of people, there's a percentage that it cuts down on the risk if you can, you know, if two people are wearing the mask. So, and that's why we go into facilities. We are definitely wear our PPEs. We don't go into a positive building and then, you know, and to be able to carry it to another building, you know, we're very careful and very conscious of that. So,
you know, masks are becoming a fashion trend.
Yes.
Just saying, I've seen a lot of people with really cool, like they're getting super creative, and I'm thinking it's going to go, you know, people are going to they're going to say, oh, I don't have to wear my mask anymore at some point in time. But I think that people are going to miss that little fashion extra. It's kind of like wearing a pair of earrings, you know?
That is true.
I'm just being silly, but
I've seen some of the home health with the face. They have the smiley on. The residents love it.
I know. It's a way to raise people's spirits. I mean, I had a friend who moved away to Alabama, and they actually, him and his girlfriend, they made masks for us, and mine has unicorns all over it. And so, because I always joke, you know, that I'm the unicorn in the room, but I love it. Like it just, you can watch people's faces as they see you, like they're pointing, or maybe they're just making fun of me, but either way, as long as somebody's, you know, finding some humor through everything, that's what's important. So
that is true.
Well, again, thank you so much for being here with us today. Thank you everybody for watching from wherever you are live streaming. Again, this is Teresa, and she is a nurse practitioner with BlueStone Physician Services. And if you're watching and you have a community, or you're interested in more information about BlueStone, I'll make sure I add all the phone numbers and website, all that good stuff to this post. And Teresa, again, thank you. And it's been such a pleasure. I appreciate your time.
Thank you so much for having me, Brittany.
Have a great day.
You too.